Medical. Keep them well. When Medicare began, from the time a child was born, grew up, went to school, started work, and grew old, life expectancy was 70 years. So when Medicare began making promises to fund health care for the elderly in 1966, the expected cost was rather low. Fast forward 50 years, and according to the Social Security Administration, a 65-year-old today will live to be 85. Those additional 15 years of life expectancy are added to the end of life, and healthcare is much more expensive still. Add the growing list of treatments and technologies aimed at extending life, and healthcare is much more expensive than it was in 1966. In order to bend the rising cost curve, health insurers are more and more interested in preventive medicine, with the benefit of not simply reducing and spreading healthcare costs out, but possibly even improving vitality in later years. For this reason, Medicare has joined the private insurers' initiatives with a meaningful and high-paying annual wellness visit, or AWV. The AWV is an important and ambitious opportunity to improve care, billing 3 codes in one encounter yielding $210 in no copay revenue. Therefore, it is time-consuming, meaning the AWV struggles to compete with the busy primary care provider's schedule. Yet time isn't the only challenge with the AWV. Patients call doctors. Doctors don't normally call patients, but the annual wellness visit requires patient engagement. Engaging patients requires doctors to recreate their workflows. That's not the way primary care medicine works. So while preventive medicine with the AWV sounds good in theory, it is a problem in practice. CMS does give some help. The AWV regulation clearly states that the annual wellness visit may be furnished by a team of such medical professionals working under the direct supervision of a physician, meaning the annual wellness visit can be performed and billed incident to. Medical created the AWV360 to assist physicians in providing the AWV for their patients. We provide a specially trained preventive medicine team led by an LPN to complete annual wellness visits under the doctor's direct supervision. The nurse-led wellness team performs the AWV for physicians in compliance with Medicare guidelines. Using Medical's proprietary AWVSolution.com web-based software application, each patient-specific risk is identified according to the supervising doctor's protocol. AWVSolution.com simultaneously queries Medicare for the preventive services for which the patient is eligible. Those services are then identified in the Medicare-required Personalized Preventive Plan, which creates the necessary antecedent for further preventive interventions. Medical will assist each physician in designing a specialized protocol for completing the AWV and identifying risk-based preventive services and screenings. The annual wellness visit identifies Medicare preventive services. The protocol may further trigger the opportunity to perform diagnostic screenings like cognitive testing and fall prevention therapies. Finally, within the same encounter, the personalized preventive plan outlines other standing order interventions. These might include cancer screenings and bone density analysis. All of these potential patient and practice benefits performed and billed incident to flow from AWV360. The value for the patient is significant. A comprehensive preventive evaluation, no copay benefits, reducing the risk of critical illness, add life to the patient's years. Providers get a comprehensive history for complex patients, strengthened and deepened patient relationships. Multiply yourself. Increase quality metrics. Enhance your reputation through proactive care. This means a busy primary care provider becomes a comprehensive preventive services provider without adding overhead, interrupting workflow, or changing the demands on the doctor's time. By example, 800 qualifying Medicare beneficiaries become at least $168,000 in additional revenue without additional effort from the physician. The patient receives the value of meaningful Medicare and other preventive benefits, while the provider multiplies time and increases the quality of the patient relationship. Within the AWV360, you get a START-compliant contract, a nurse-led wellness team, as well as all the technology and consultation necessary with a HIPAA-compliant business associates agreement. The doctor provides a complete list of Medicare beneficiaries, access to the EMR under HIPAA regulations, and exam space if necessary. For more information about AWV360, please contact Bennett Medical.